Namaste everyone. Heart attack is very common nowadays. It is also seen in age group of 30 to 50 years of age, which is very young age, but we generally see it. So it is very important that we are all aware what CPR is all about, how to use a AED defibrillator machine. So today in this podcast, you will come to know how to use it. So please keep watching this video and learn all about it. CPR basically can be explained with two common terms, which is DRS and ABCD. Now you need to know what is DRS. D stands for danger, detect a danger and identify the place where the patient is lying. R stands for response, check for patient's response time, whether the patient is responding or not. S is seek for help. So you should call an emergency first and then start giving the CPR. Now what is CPR all about? So before we start to talk how to give CPR, we need to understand 4 checks which we need to do. First is airway. First thing you need to check patient's nose and mouth and see if there is any vomit or blood. If it is there, then you need to remove it. Any choking you find in the airway, you needs to be removed. That is A. Then comes B. B is breathing. You need to check. Put a finger here and check whether the person is breathing or not. You need to check the heartbeat here, and if not here, then you can keep the 2 fingers right near the throat to check if there is a heartbeat or not. Many a times you might not see the heartbeat from here, but you can sense the beat from the neck, throat, right? So you should put 2 fingers here either side and you can see whether the person is breathing or not. After checking A and B, you need to start your step C. Now step C is the CPR, which is explained in detail by Dr. Kannan in my video, and then comes D. D is using a defibrillator machine, that is also explained in the video. So please do watch this video and share it maximum with your friends, family, so that everybody around you knows how to give a CPR and use a defibrillator machine in case of emergency.
Okay, now please bear in mind that the surface below has to be hard, because when you're giving compression, if it's a very soft surface, then the force will not be transmitted, right? So a lot of times if the person has collapsed on a bed or something, we try and look for a hard board or something just to slip it under. Okay, this is recommended for best result, but sometimes it may not be possible. Okay, so you have to sit by the side of the person. Which side, right or left? Any side. Okay, you can kneel. You have to kneel. You don't have to sit like this. Okay, you have to be upright. Okay, you have to be upright. You have to give 30 compressions followed by 2 mouth to mouth or rescue breaths. Okay, so 30 compressions you have to give with both your hands. All right, you have to give with the border of your hand, not with the entire palm. Okay, so how do you do it? You are sitting on either side of the person. You either put your right hand over the left or left hand over right, whatever is comfortable for you. Your body is at a perpendicular, is perpendicular to the patient. You can see the nipples here. Just draw an imaginary line, approximately 2 fingers below that, approximately. Okay, where is the heart? No, center. Okay, it is tilted. It is tilted to the left. Okay, but it's placed in the center. Yeah, we keep doing this. This is not heart. Heart is in the center, tilted to the left. That is why all of us have undergone an ECG. If you see the leads, they are placed from here to here. Yeah, they are not just placed here. They go from here to all the way up to here. Okay, so in the center, 2 fingers. Place your arms. The arms have to be straight perpendicular. Okay, and you have to place this part on in the center here, and you have to compress 1, 2, 3, 4. So while compressing, it's important that you don't move like this, right? The more you move your body, the less force will be transmitted. Now this is a mannequin. It's very easy to do this. Imagine a real body. Okay, it's very difficult because it's hard, right? So you do this 30 times. 1, 2, 3, 4, 5, 6. ऐसा 30 times. Approximately 100 compressions in a minute. Approximately, which means that your compressions have to be rhythmical. Yeah, you cannot go 1, 2, 3, 4, 5, 6. You cannot go 1, 2, 3. Yeah, you have to go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14 till 30. Okay, 30 compressions done. The compression has to be approximately 1.5 to 2 inches deep. Your hands should go in. Okay, so that is compression. Then you come to mouth to mouth. Now, as per the American Heart Association, most important is compressions. You may or may not be able to give rescue breaths. Yeah, one, the technique may not be correct. Second, there could be a situation where the person is unknown, right? Here in office we have something called a CPR film. If you've not seen it, go to any of our first aid boxes. There is a plastic film which you just put over the person's mouth. So direct contact is not there. Okay, but in most situations outside your house you will not have it. So it's okay if you're not able to do the rescue breath. Compression is most important. Okay, now if you can do rescue breaths, then 2 rescue breaths. You have to give your inhaled air. Hold, put it in his mouth. It cannot be, yeah, because your inhaled air contains 21% oxygen. Exhaled air only contains 4%. So then you are actually not giving oxygen to the person. Okay, how do you give it? Now here, this thing is perpendicular. Yeah, it's tilted. So you have to straighten it. Right? So what you do is you straighten it. You close the person's nose, because you give it through the mouth, it should not come out through the nose, right? You lower the person's lower jaw, breathe, form a tight seal and put the air inside. Breathe out in his mouth. Aisa 2 times. Okay, 32. If there are 2 people, then I stop the 30 compression, then the person give 2 breaths. The person gives 2 breaths, then I start compression, not both together. Okay, after doing 3 cycles of this, okay, then you again check, has the breath sounds come back, has the pulse come back. If it has, then you turn the person on one side, yeah, and you keep monitoring the person. If not, you have to continue. Okay, you continue till when?
Till the ambulance came.
Yeah, till the person revives or till the ambulance comes or the doctors come. Okay, so you cannot just abandon the person. Second most important thing, never declare death. Yeah, you do CPR, maybe the person is not getting revived, you will not go out or not tell people that, oh, he's no more. Yeah, that is not your responsibility. Yeah, it's wrong. That the doctor or the medic will declare that the person is no more. Okay, so 30 compressions, 2 breaths, arms are stretched. Okay, you are kneeling by the side of the person and you are giving the 30 compressions. Okay, now after this, I just wanted to show you this is an automated external defibrillator. It's a very useful device to have. So you must have seen in hospitals, in Bollywood movies, paddles leke the doctor is shocking the patient. Yeah, so this is to deliver shock. But this device is autonomous breathing, nothing is there. Okay, the first thing if you can use is use an AED. First thing, even before you start CPR. Okay, so how do you use an AED? So I cannot use it because I cannot deliver shock here, but I'm just showing it to you. So this is the machine. This is the machine. Okay, you see 2 buttons. The green one is to on it. This is to deliver the shock. So what happens is a person collapses. You call for the AED. Once the AED comes, you kneel next to the person, bare his chest. Okay, then you have 2 pads like these. Okay, and on these pads it is already labeled which pad has to be put where. So this pad has to be put here, below this collarbone, and this pad has to be put here. Okay, so you just have to apply, you have to peel them. There's a peel, you just stick it. You stick the two pads, okay? Then what will happen is you on it. Once you on the machine, the system will tell you analyzing rhythm. So now in the heart, if somebody collapses, there are two types of rhythm. One is a shockable rhythm, the other is a non-shockable rhythm. So this device will analyze whether the rhythm is shockable or not. Okay, so if the rhythm is shockable, then the device will tell you shockable rhythm, deliver shock, stand by. Okay, so you have to move behind, you have to press this shock button. Once you press that button, the shock is delivered. Okay, like this shock can be delivered at a stretch 3 times. So once the shock is delivered, again this machine will analyze. Again this machine will analyze whether the rhythm has come back or not. If not, then the device will tell you again shockable rhythm, or it will tell you continue CPR. If the rhythm is not shockable, it will tell you not shockable rhythm, continue CPR. So then you don't need to deliver it. Okay, so here you don't need to use your head at all. All instructions are given by the device.
I hope now you know how to give a CPR and use a AED machine. If your society doesn't have an AED machine, please ask a society to own a AED machine. Every society nowadays should mandatorily have an AED machine. It's not very expensive tool, but it can save one's life. So please ask and request for your society to have one AED machine for sure. I hope this video was useful. If it was useful, do share it with your friends and family, and do subscribe to my channel if you're new to the channel, because I bring these kind of awareness videos for you. Thank you.